to Medicare Tales and Marshmallows, the only podcast where health insurance meets heartfelt stories and a few slightly burned s'mores. I'm your host, Kim the Curious, here with another fireside chat that's about to get personal, practical, and downright patriotic. Today's guest is the kind of guy who can fix a broken Humvee in the desert and decode his Medicare Advantage plan all before lunch. He's a seasoned veteran with stories, insights, and a wicked sense of humor. Please welcome Tony R. to the campfire.
Glad to be here, Kim. I brought marshmallows, but I'm afraid I seared them. Black on the outside, molten in the middle, and emotionally confusing.
Just like our healthcare system. So, Tony, how does a guy with VA coverage end up in a Medicare Advantage plan?
Short version, I don't trust the system to run on one engine. The VA is solid, for most things. But try getting a civilian podiatrist through the VA. Might as well request it through Morse code. Medicare Advantage gave me a backup plan, especially for urgent care and dental.
Smart man. And what's working for you with the Advantage plan?
I got a $0 premium plan that works fairly well. The urgent care copays are low, and I can go to a civilian dermatologist because the VA derm clinic in my area was booking out past the next Winter Olympics. The Advantage plan gave me access to local docs. Plus, it covered things VA doesn't always prioritize, like vision, dental, and acupuncture. Yes, I tried that, and yes, I screamed.
You and needles just don't get along, huh?
Nope, unless they're on a record player.
Record player? What's that? Just kidding. But I think we just dated ourselves. Yikes. You mentioned the dental benefits. Can you shed some light?
Game changer. I hadn't seen a dentist in years because my VA plan did not cover dental. Some of my buddies do have dental, so I guess each situation is different, and I don't know all the details as to why. Anyway, with my Advantage plan, I got 2 crowns and a cleaning. Cost me less than a tank of gas, and the hygienist didn't flinch when I told her I once flossed with a fishing line.
That's probably not recommended. Additional benefits are great, but let's talk challenges. I know can't all be rosy. What's not working?
Coordination, or lack thereof, is probably the biggest. The VA and Medicare Advantage don't talk to each other at all. I have to carry records between systems like I'm delivering secret intel. And sometimes Advantage plans assume you're not using the VA, so they try to upsell you on things you don't need.
Really? Like what?
Home delivery for prescriptions I already get free through the VA. I told one rep, why would I pay $10 for something I already get mailed to me with a smiley face sticker from the Navy pharmacy?
Word. On that note, all right, let's talk dollars and cents. How's the cost sharing been working out for you?
Not too bad, considering, like I said, I still get most of my prescriptions through the VA. Cheaper that way for my situation. But the Medicare Advantage plan has some decent perks. $0 premium, low copays for doctor visits. I had a $40 copay for a podiatrist once. That's the guy who looked at my feet and said, "You've got veteran toes." I didn't ask what that meant.
Veteran toes? Sounds like a punk band. Still, fair point. Ever run into cost-sharing confusion?
Oh, sure. I once got billed for an out-of-network visit when I specifically picked the provider off the plan's site. Turns out he used to be in-network, then left, then came back, like a healthcare soap opera. I called, they reversed the charges after I faxed them 6 pages of proof and a drawing of my frustrations made with permanent markers.
Art therapy via fax. Love it. Where'd you even find a fax machine or software?
Right? That's a whole nother story, Kim. Now, non-VA hospital stays, that's where you also got to be careful. My Advantage plan has a daily copay for the first few days. I told my kids, if I go in, visit fast. I'm checking out the next day even if I have to belly crawl out of there to get to a VA hospital.
So, how do you juggle the two systems? VA on one side, Medicare Advantage on the other.
It's like having 2 neighbors who both want to help you, but they don't talk to each other. I keep a folder. I ask a lot of questions, and I don't assume anything's covered until someone puts it in writing. It's all about strategy. VA for primary care and prescriptions. Advantage for civilian specialists, dental, and acupuncture. I have a laminated cheat sheet I made myself. My wife calls it the Constitution of Tony's Healthcare.
I need a copy of that. If your Medicare Advantage plan were a person, who would it be?
Probably a helpful neighbor who means well, brings you casseroles, but sometimes forgets what to tell you what's in them.
Mysterious benefits in foil pans. That about sums it up. Okay, I want to dig a little deeper into this notion of neighbors who don't talk to each other. I'm sure you have some horror stories from your buddies if you could share without violating anyone's privacy.
Oh yeah, I call them tales from the paper-pushing crypt.
Spooky.
Okay, let's see. Well, there's my friend, let's call him Joe. Thought he had it all squared away. TRICARE for life, Champ VA for his spouse, plus some kind of MA policy he couldn't quite remember the name of. I swear his wallet looked like a Pokemon deck, just insurance cards instead of Pikachus.
Oh no. So what went wrong?
He goes to get a simple dermatology check. Doctor takes one look at his ID cards and says, "Sir, you're either going to have to pick which one's primary or explain them all to my billing department." Long story short, Joe left without getting the spot looked at and got 3 different explanation of benefits letters that didn't explain anything.
Ouch. Any others?
Well, then there's Tina, Army nurse, retired. She's got Champ US from way back, old name for what's now TRICARE, Medicare A and B, and she picked a PPO Medicare Advantage plan because she travels. One time she ended up in Alaska, broke her wrist, and the hospital spent 4 days figuring out which plan to bill. By the time they sorted it out, her wrist had already healed halfway, crooked.
Oh my God, that's just terrible, and yet sitcom level absurd.
Exactly. And then you've got folks who think VA covers everything. Let's see, who else? Yeah, my buddy Hank, Army vet, signed up for a 0 premium MA plan because he liked the dental coverage. But then he went to a civilian ER thinking VA would pick up the tab because he's covered by the government. Yeah, no. 2 systems, 2 sets of rules. He got a bill that looked like a Pentagon budget line item.
So, the moral of the story is...
Know what you've got, how they work together, and keep a strong drink nearby when reading the paperwork.
Tony, thank you for your service, both in uniform and in helping our listeners dodge these bureaucratic landmines. Okay, final question. Any advice for fellow vets looking at Medicare Advantage?
I tell every vet I meet, don't assume one system does it all. You might need both. Medicare Advantage gave me more flexibility, especially when I needed physical therapy close to home.
Right.
But I still go to the VA for big stuff. They've earned my trust. Also, don't just pick the plan with the flag on the brochure. Ask, what does it cover that the VA doesn't? Are the civilian providers actually nearby? Don't enroll just because your buddy said it's free. Read the fine print and make sure your Advantage only complements and does not cancel your VA benefits, especially when it comes to prescriptions.
Right.
Finally, and this is big, get someone to explain coordination of benefits. If they can't explain it in one sentence, they don't understand it either.
Tony, you've made sense of multiple federal systems colliding and lived to joke about it. You're a legend.
Just doing my part, Kim. And if anyone needs help appealing a Medicare Advantage denial, I charge in bourbon and marshmallows.
Tony R., everybody, a man who served his country and now serves truth bombs with a side of humor. That's a wrap on today's episode, folks. Whether you've served your country or just survived open enrollment, the message is the same. Know your options, read the fine print, and have some bourbon and marshmallows ready for when you're on hold.